Hello, everyone. My name is William Chey, and I'm a professor of medicine and nutrition sciences at Michigan Medicine in Ann Arbor, Michigan. I'm so pleased to join you today to talk about Helicobacter pylori infection. Before I start the talk, I want to thank the IFFGD for involving me in the Norton Education Series. I'm so excited to participate and to tell you about this very interesting story of H. pylori. As we start the discussion about Helicobacter pylori, we have to go back a number of decades to discuss the timeline, the history of peptic ulcer disease. Remember that ulcers are these punched out abnormal areas in the stomach and first part of the small intestine called the duodenum that can lead to significant bleeding or even rupture of the wall of the stomach or duodenum. It's what we call perforation. And for years and years, decades, for decades, in fact, the dictum for the cause of peptic ulcer disease was no acid, no ulcer. In other words, doctors and scientists felt that ulcers were resulted from excess production of acid in the stomach. And so, not surprisingly, the attention in terms of development of treatments were all aimed at trying to figure out a way to neutralize or reduce acid production in the stomach. In fact, the earliest treatments involved the ingestion of dairy products like milk or the ingestion of eggs, so-called SIPI diet, that was thought to neutralize acid in the stomach. This led to the development of something called the doll's milk drip, where a tube was actually placed into the stomach and milk was dripped into the stomach in the hopes of neutralizing stomach acid and in that way helping with ulcers. Just before the turn of the 20th century, surgeons began to do operations where they actually would resect the part of the stomach that was responsible for producing acid. And then in 1943, surgeons figured out that they could actually cut a nerve leading to the stomach called the vagus nerve, which is responsible for stimulating the cells in the stomach that produce gastric acid secretion. So by cutting this nerve, they could actually lead to a reduction in acid secretion. And then putting two and two together, surgeons figured out that they could actually resect part of the stomach and cut the vagus nerve and potently reduce acid secretion. By the 1960s, physicians and scientists had figured out that they could use antacids instead of surgery to neutralize stomach acid, and also medications that were available at that time called anticholinergics, which are medications that inhibit the stimulation of the stomach to produce acid. Now, unfortunately, these therapies didn't work very well, and also they could lead to significant side effects. So anticholinergics led to drowsiness, constipation, a whole host of different side effects, which were quite unpleasant for patients. In the 1970s and 1980s, there was a very important discovery of a class of drugs called the histamine 2 receptor antagonists. These were drugs that actually more potently and for longer periods of time inhibited the production of acid in the stomach. And they were thought to be revolutionary in terms of the treatment of peptic ulcer disease and also conditions like gastroesophageal reflux disease. In fact, these H2 receptor antagonists like cimetidine, which is also known as Tagamet, or ranitidine, also known as Zantac, were some of the first blockbuster drugs. These are drugs that actually accounted for more than $1 billion in sales on an annual basis. Then, in 1982, Robin Warren and Barry Marshall turned in a very important scientific report where they suggested that the primary cause of inflammation and ulcers in the stomach and duodenum, so peptic ulcers, the primary cause of peptic ulcers was a bacteria called Helicobacter pylori. Helicobacter pylori is a spiral-shaped bacterium that lives in the mucus overlying the lining of the stomach. Now remember that the stomach, because it produces lots and lots of acid, was for years and years thought to be a sterile environment. In other words, no bacteria were thought to be able to live within the harsh acid environment of the stomach. But this particular organism, Helicobacter pylori, figured out a way to burrow into that mucus gel overlying the lining of the stomach, and in that way protect itself from the very harsh acid environment of the stomach. And the discovery of Helicobacter pylori and its association with development of intense inflammation in the stomach, and eventually, for some individuals, development of peptic ulcer disease, led to a so-called paradigm shift. That is, a complete change in the way that we thought about peptic ulcer disease, from this dictum of no acid, no ulcer, to peptic ulcer disease and gastritis being an infectious disease, not unlike syphilis or strep throat. Now, as you might imagine, the scientists and also industry that had been benefiting or had put forth this idea that ulcers were the consequence of acid, and now a multi-million, multi-billion-dollar industry of producing drugs that suppressed acid production in the stomach. There was a lot of resistance to this idea that gastritis and peptic ulcer disease were infectious diseases. And in fact, Barry Marshall and Robin Warren put up with a lot of negative feedback as they tried to put this idea forth that led to this paradigm shift in the way that we think about gastritis and peptic ulcer disease. In fact, when they were eventually borne out to be true, they actually received the Nobel Prize for Medicine in 2005. And I want to share with you this story. When Barry and Robin turned in their original report of a series of patients in which they observed this unexplained bacteria overlying the stomach lining in individuals with this intense inflammation in the stomach, they turned this report into the Gastroenterological Society of Australia, and they received notification in regards to their presentation in the form of this letter, which said, "I regret that your research paper was not accepted for presentation on the program of the annual scientific meeting for the Gastroenterological Society of Australia to be held in Perth, Australia in 1983. And if you hone in on this next section, the number of abstracts we receive continues to increase. And for this meeting, 67 abstracts were submitted, and we were only able to accept 56. So of the 11 abstracts that were not accepted to this meeting, it turns out that one of them accounted for the Nobel Prize in Medicine in 2005. So something to take away from this, a remarkable story of determination and even stubbornness that led to a paradigm shift that helped us to recognize that in many patients, inflammation in the stomach and peptic ulcer disease is actually an infectious disease. So let's turn our attention now to H. pylori infection. H. pylori turns out to be one of the most prevalent infections worldwide. In fact, more than half of the world's population is infected with this particular bacteria. In the United States, that prevalence is a bit lower, but still, a third of people in the United States are infected with H. pylori infection. If you look at this map which depicts prevalence of H. pylori based on geography, what you notice is that the southern states in general have higher prevalences or a higher rate of H. pylori infection than the northern states. And this is particularly true if you look at the rate of infection amongst African Americans, Latinxes, and Asians, where the infection rate is higher than in American-born Caucasians. In fact, it's been argued that one of the biggest drivers for H. pylori infection in the United States in the coming years will actually be immigrants. Now, there are a number of clinical consequences related to chronic H. pylori infection. I reviewed some of them with you already. The idea that the most common cause of gastritis is H. pylori infection, a very common cause, the most common cause, identifiable cause of peptic ulcer is also H. pylori infection. But very importantly, H. pylori has now been assigned the designation of a class 1 carcinogen by the World Health Organization. So in other words, H. pylori seems to be associated in the pathogenesis or development of gastric cancer. Now, the good news is that only a very small minority of patients develop peptic ulcer disease, probably 10 to 15% at most of individuals with H. pylori infection will go on to develop an ulcer at some point in their life. Most of the time, they won't even know. And an even smaller, infinitesimally smaller percentage of individuals with H. pylori infection will go on to develop gastric cancer. But nonetheless, one of the most common identifiable causes for gastric cancer is H. pylori infection. There are also a number of other diseases which have been associated with H. pylori infection. So patients with unexplained upper abdominal pain or dyspepsia, it turns out that H. pylori infection is a potential cause for those symptoms. Also, individuals who are starting therapy with aspirin, so like if you had a heart attack and you get started on aspirin, or non-steroidal anti-inflammatory medications, so things like Aleve or Motrin. So if you have arthritis or back pain and you're having to use those medications, individuals with H. pylori infection that use aspirin or non-steroidal medications are more likely to develop an ulcer than individuals who are using those medications without H. pylori infection, or even have H. pylori infection without using the medication. So the presence of the infection and those medications seems to play off one another to actually more than double your risk of developing an ulcer. Also, individuals with unexplained iron deficiency anemia, turns out that H. pylori can cause that or has been associated with iron deficiency anemia. And finally, idiopathic thrombocytopenic purpura, a condition where the platelet count is low for reasons that aren't apparent. H. pylori infection can also cause or has been associated with that condition. There are a range of different diagnostic tests which can identify if a person is infected. So tests that don't require endoscopy and tests that require or can be performed at the time you undergo endoscopy with an endoscope. The tests that don't require endoscopy can utilize blood to identify antibodies to the infection, breath samples to identify metabolic consequences of H. pylori infection, or finally, stool testing to look for antigens or proteins that are shed by the bacteria that lives in the stomach. For endoscopy, there are tests that again can identify the metabolic activity associated with the organism. There are special stains that one could use to directly identify H. pylori organisms. And then there's culture, where you actually grow the organism in a petri dish with certain types of media. Now, in general, we're moving away from using blood testing to identify antibodies and really focusing our non-endoscopic tests on either breath tests or stool tests. Those are the most accurate tests. And if you're getting tested for H. pylori infection, the best tests to get, if you're not getting endoscopy, are a breath test or a stool test. If you get a breath test or a stool test, you should make sure that you haven't taken a proton pump inhibitor like omeprazole, lansoprazole, pantoprazole for 1 to 2 weeks before you get tested. You should make sure that you've been off of bismuth or antibiotics for any reason for at least 2 to 4 weeks. Treatment for individuals who are found to be infected consists of 2 to 4 drug regimens. Invariably, these regimens contain a proton pump inhibitor, so again, drugs like omeprazole, lansoprazole, pantoprazole, and then some combination of 1, 2, 3 antibiotics, usually drugs like amoxicillin, clarithromycin, tetracycline, metronidazole, levofloxacin, or rifabutine. And it's very important, even if your doctor doesn't ask you, if you're getting started on a treatment for H. pylori infection, to avoid antibiotics that you previously received for any reason. So let's say, for the sake of argument, you're diagnosed with H. pylori infection, and back when you were a teenager, you received a number of courses of clarithromycin or azithromycin, so a Z-Pak, for strep throat or sinus infection. You should not receive treatment that contains clarithromycin. You should try to avoid that, because if you have H. pylori infection, it's very likely to be resistant to that antibiotic. In general, treatments last for 14 days. It's very important to make sure that you take all the medication as prescribed for the proper duration of therapy, because here's the thing: your best chance to get rid of this infection is with your first try. If you don't get rid of the infection with the first try, it gets progressively harder and harder to get rid of the infection with subsequent courses of therapy. So being disciplined and taking all the medications for the specified duration of treatment is critically important to making sure that you successfully eradicate this infection. So to summarize, H. pylori infection is one of the most common human infections. In the United States, about a third of Americans are infected with this particular bacteria. H. pylori is an important cause of inflammation in the stomach, also known as gastritis, peptic ulcers, so ulcers in the stomach and first part of the duodenum. It's also been implicated in the development of an increased risk of gastric cancer and unexplained upper GI symptoms, particularly upper mid-abdominal pain. There are blood, breath, stool, and endoscopic tests to identify H. pylori infection. In general, you want to stick to the breath tests, the stool tests, and the endoscopic tests, and stay away from the blood tests. Treatment consists of regimens containing 2 to 4 drugs given for 14 days. And by the way, there are a number of highly effective new therapies which have either recently become available or will be becoming available in the next couple of years. Patients treated for H. pylori should undergo a test to make sure that the infection is gone. This should be done no less than 4 weeks after completing a course of therapy. So I hope you've enjoyed this talk. I hope you've learned something about H. pylori infection, about being stubborn and persistent and advocating for yourself. And I hope you enjoy the rest of the Norton Education Series 30th anniversary program. Thank you very much.